time. So good evening, and thank you for joining us today for the National Drug and Alcohol Facts Week Tri-County webinar. My name is Rachel Rhodes, and I am the Prevention Coordinator from Oakland Community Health Network. This evening, we'll be sharing information from the Tri-County Collaborative, including Detroit-Wayne Integrated Health Network, Macomb County Community Mental Health, and Oakland Community Health Network. National Drug and Alcohol Facts Week, or NDAFW, is an annual week-long health observance that inspires dialogue about the science of drug use and addiction among youth. It provides an opportunity to bring together scientists, students, educators, healthcare providers, and community partners to help advance the science so that we can improve the prevention and awareness of substance misuse in our own communities and nationwide. It was launched in 2010 by scientists at the National Institute on Drug Abuse, which we call NIDA, to stimulate educational events in communities so teens can learn what science has taught us about drug use and addiction. The National Institute on Alcohol Abuse and Alcoholism became a partner in 2016. And alcohol has been added as a topic area for the week. NIDA and NIAAA are part of the National Institute of Health and work with leading organizations, media outlets, and other government agencies to spread the word about NDAFW, or National Drug and Alcohol Facts Week. So please watch the chat throughout the webinar for some valuable information and resources that we will be sharing throughout the night. Now, I'd like to introduce our first speaker for the evening. Please welcome Andrew Brown, who is the Program Manager of Recovery Services at CARE of Southeastern Michigan. Andrew?
Hi, thanks, Rachel, and thanks everyone for having me here today. Very grateful. I just wanted to say before I get started, I think I'm going to play a little video here in a second that makes me look really good. So I'm glad we were able to include this video. Like I said, I'll let that do the talking, then I'll proceed after that. So I want to say thanks for including that video. That saves me from giving my introduction, and it was a lot better done in editing than I could do in real time. So thanks for sharing that. So I'm going to talk a little bit about programs we have at Care of Southeastern Michigan that are funded through Macomb County Office of Substance Abuse. So the mission statement for CARE is to strengthen resiliency in people and their communities through prevention, education, and services that improve the quality of life. So a little bit about CARE. We've been a CARF accredited agency since 2002. We're 2017 one of Crane's best managed nonprofit finalists. We in 2019 and 2020 we were recipients of Detroit Free Press Top Workplaces, recipient of a 2019 Greater Area Detroit Health Council Salute to Healthcare Awards. We currently have just around 120 employees. I think we have a few spots to fill, and we've experienced 100% growth since 2016. So the services we offer at Care Southeastern Michigan, our biggest programming and a lot of the growth is obviously the peer recovery coaching I talked a little bit about in the video. We're an outpatient provider for MACOSA, so it's really cool. We can combine services, continuum care with outpatient therapists, along with a peer recovery coach and so forth. Another big piece of what we do is our substance use prevention programming. Our community coalitions, we work with a number of communities throughout Macomb County and Wayne County. We also do a lot of community health education and advocacy work. And there's the kid in the background that was in the video. He still makes noise, so apologize in advance. But so we do a lot on that. We do a lot of specialty case management services, some funded through the Macomb County Office of Substance Abuse, and some through, we do some work with CPS and other agencies. We have a student assistance program. Kids getting in trouble in school or anything like that, or needing an assessment for substance use or any other kind of things, we do that. And we also have a EAP we provide to multiple communities and businesses in Macomb County. So I'm going to dive into a little deeper on the history of peer recovery coaching. So I started at CARE in 2014. Like I was going to tell you, but the video did. I was also a recipient of CARE services in 2007 on multiple occasions, and they were really pivotal in my recovery journey. And then right around 2014, I heard about this thing called peer recovery coaching, and took a chance, took the position. I wasn't too sure about it, but the rest is history, and I love being there. When I started, the program started in 2012. So when I started in 2014, it was still only 5 coaches. It was 2 full-time, 2 part-time coaches and a supervisor. So I was a little nervous about starting there because it was like a newer position. So, after I started, I made coach number 6, and today we have 43 coaches. We have a full-time director. We have 2 managers, which I'm one of. We have 6 supervisors and 34 full-time coaches. And all those people from the director down are in recovery themselves. So what is a peer recovery coach? At Care of Southeastern Michigan, being employed as a full-time peer recovery coach, that means an individual with 4 continuous years in active long-term recovery from substance use, has a shared life experience at receiving services and understands this perspective, is not a psychotherapist, sponsor, or case manager, and has either completed the Connecticut Community Addiction Recovery, CCAR, which is really one of the first training models, or also there's the CPRC, which is Michigan's NDAFW certification for peer recovery coaches. CARE, like I just had kind of said, CARE peer recovery coaches have completed the Connecticut, the CCAR model, or the state certified CPRC model, and CARE's PRC members either hold the CPRM or the CPRC certified credential. So what's the role of a peer recovery coach? The role of a peer recovery coach is that they assist people in early stages of recovery from addiction through a shared experience perspective, help identify which pathway is the best fit to sustain recovery, encourages individuals how to live a healthy lifestyle through the development of a recovery plan. Sorry, I can't see the rest of my slide here. Assist and supportive systems and resources regarding professional and non-professional services. Sorry, it was a little blocked out here at the bottom. So some of the areas of focus we work on, we utilize motivational interviewing to an extent. We promote self-care among our employees. Obviously, we have a number of things, especially for peer recovery coaches. We face a real high level of burnout, as I'm sure many of you working as therapists and everything. But, you know, we work with a lot of traumatic situations and secondary trauma. So we're really big at providing compassion, fatigue, and support to support employee self-care. We do recovery planning with the people we work with. We support multiple pathways to recovery and really all pathways to recovery. We reduce stigma in the community as well as in a person-centered way. Health and wellness, person-centered planning, and trauma-informed care. So peer recovery programs. So through an innovative approach of creating community partnerships and collaboration, CARE expanded peer recovery programs into fields outside of behavioral health and in non-traditional settings. Positive impact on services we have when joining with other community partners. We're able to provide complete specialized care, telehealth and personal-centered care. Obviously, with person-centered care with the pandemic, we obviously got very used to Zoom and Teams. People getting treatment versus handing resource information. So, you know, we're able to be a voice at some of these non-traditional settings, and overall attitude change within staff and those needing help. And I'm going to show you some of those settings we work within. So our footprint, community-based, that was the original team. That's one of the teams I manage. We work with the Macomb County Access Center, so referrals for people that come in for residential or outpatient treatment. We get them connected with a peer. We partner with 5 community drug and sobriety courts in Macomb County. We have our Recovery United Community Center, which is our recovery center in Fraser, Michigan. We actually opened it in 2019, and we're planning our grand opening for March 2020, and we all know what happens. So, you know, but finally we're getting quite a few people in there. You know, it's a great thing it's a great RCO, you know, recovery community organization right there in Fraser. Quick response team, overdose outreach. We work with partner sites at emergency departments within Macomb County. We've partnered with primary care facilities, community corrections. Is that what that says? Sorry, it's like blocking the line there. And Macomb County Jail. And we have our 2 locations. Our main office is, we're about a half mile from each other. We're right on Utica Road, and our Recovery United Community Center, the address is up there too. Encourage you, that's open to anyone. We have a lot of programming, non-traditional programming outside of traditional 12-step recovery. You know, we're just open environment to anyone in recovery or any family members seeking support. So really appreciate the time. I hope I didn't go over 10 minutes, but thank you.
Thank you so much, Andrew, for that very informative presentation. We appreciate the information and all that CARE of Southeastern Michigan is doing in the community. Now I would like to introduce our next speaker, Christy Smeegi. She is the Director of Substance Use Disorders at Oakland Community Health Network. Welcome, Christy.
Thank you so much, Rachel. Good evening, everyone. I'm pleased to be here with you tonight. Thank you for your interest in this important information. Oakland Community Health Network is a community-based local public health system that manages specialty support and services to infants through older adults. These are persons with serious mental illness, serious emotional disturbance, intellectual developmental disabilities, or substance use disorders. And note that most people who do receive services through Oakland County's public behavioral health system that is managed by Oakland Community Health Network do have Medicaid insurance coverage, although we do offer services to individuals who are uninsured and underinsured as well. The mission of OCHN has 3 parts. We hope to inspire hope, basically that recovery is possible, empower people, and strengthen the communities that we serve in Oakland County. What I'm going to do is go through our various substance use disorder treatment and recovery programs. We also have prevention programming that when Rachel introduced herself, she coordinates all of those services. We have 22 prevention providers, but I'm going to describe our treatment and recovery services. First, we have our RISE Center, which is short for Recovery Information Support and Education. And this is a place where you can receive assistance that connects county residents to resources. It is open to the community and can also help maintain recovery and early intervention for those who might be in danger of relapse. These services are provided by skilled case manager and certified recovery coach, like Andrew was just describing. We also have an access center, our central screening center for all Oakland County residents. The phone number for that is 248-464-6363, and it can be accessed by phone or in person. For phone access, Monday and Thursday, the hours are 8 a.m. to 8 p.m., Tuesday, Wednesday, and Friday, 8 a.m. to 5 p.m. And if someone does want to walk into the facility, which is at 1200 North Telegraph in Pontiac, walk-in hours on Monday and Thursday are 8 a.m. to 6:30 p.m., and then on Tuesday, Wednesday, and Friday, 8 a.m. to 3:30 p.m. We have what we refer to as a sober support unit, and this is a 24/7 sobering and monitoring program where individuals who are drunk or high on drugs can come in and we will assist them with immediate substance use needs. They will be triaged through our contractor, Common Ground, and this is also at that facility at 1200 Telegraph in Pontiac. The person must be medically and psychiatrically stable, so they can't have any physical health or mental health issues that would require emergency department or a medical admission at a hospital. And as medically necessary, individuals will be assisted in being referred to a higher level of substance use disorder care that I'll be describing in a few minutes, such as residential services or medication-assisted treatment. One of the things that the Sober Support Unit does is reduce non-emergency hospital visits by giving people a place where they can come down off their alcohol or drugs. But it also enhances jail diversion because sometimes these folks end up being taken to jail, and that's a very, very positive thing to help them come down in a safe environment so that that doesn't happen. As I'm describing our levels of care, a couple of services that are found across our continuum of care: case management services. These are services that provide linking and coordination of services such as transportation, housing, financial and budgetary support, basic needs like food, shelter, and clothing, medical, literacy, educational, vocational, and also childcare services. We also, again, like Andrew wonderfully described, we incorporate peer recovery services or coach services as well. Again, individuals with lived experience in recovery provide connections to services and supports for individuals with active substance use disorders. And these peers help to navigate recovery resources, help individuals during treatment and while they're transitioning from treatment programs. They help to motivate and inspire hope. Again, the hope that recovery is possible from someone who's been there. And they also help individuals identify and remove personal and environmental obstacles that can stop folks from getting a foothold in their recovery. And then starting with the highest level of care, withdrawal management. These are services that are under the supervision of a physician and other medical care providers. They help to reduce the amount of addictive substance in a person's body and control the active withdrawal symptoms that individuals can experience. And usually that's through medication. And in the case of alcohol, this can avert a life-threatening medical emergency. You've probably seen shows or movies where someone is coming down off of heroin or crack or another drug or alcohol, and you see the kind of discomfort that people experience. And that's what withdrawal management does, is help to alleviate those symptoms. And in the case of alcohol, when someone has been drinking heavily on a prolonged basis over a period of time, it can actually be very dangerous just to abruptly stop. Residential treatment is a 24-hour live-in setting, and it incorporates a number of organized services from substance use treatment professionals and also mental health personnel. Our providers are what we call co-occurring competent, because many individuals that are experiencing substance use disorders may also have what we call a co-occurring mental health condition. Recovery housing is a level of care. Individuals often, when leaving a residential treatment program, or sometimes if they have achieved some sobriety, may need structure in staying sober or staying clean from their drugs. Recovery housing creates a mutually supportive recovery community that can help individuals by providing access to resources and also help them build skills that can help them sustain their recovery. That is often called recovery capital. And we always seek to treat the whole person, and this means improving residents' well-being overall, mentally, physically, spiritually, and socially. Outpatient services is the lowest level of care. We have something called intensive outpatient, which might be a few days a week, where an individual participates in groups and individual counseling, and could be family counseling as well. But traditional outpatient services are what you would typically think of when someone goes to see their therapist. It might be once a week, maybe a couple times a week, as they're doing better, maybe every other week or once a month. But this could be initially treatment readiness groups, or what we refer to as early intervention, but typically consists of individual therapy groups, which can be didactic or educational or therapy groups, and family therapy. And also, as I have already described, case management and peer recovery coach services are included as well. Medication-assisted treatment is treatment that can start at the residential level and continue into outpatient, or can just simply start at the outpatient level. And medications are used in combination with behavioral health interventions, such as I have already described. The medications that are used for opioid use disorder, methadone is a medication that has been around since I think the early 70s. So it's a tried and true medication that's dosed daily. Suboxone is a more recently developed opioid replacement medication, which is also daily. Vivitrol is a monthly injection that is used for opioid dependence, but also alcohol dependence as well. And the last thing I wanted to talk about are women's specialty services. These are state-designated treatment services that are programs that are designed to understand the unique substance use and recovery needs for women, particularly pregnant women and women with young children. But they also provide some services for fathers and primary caregivers by giving them support and linkages to community resources that can assist with their family needs. So thank you again so much for your interest in this important information.
Thank you so much, Christy, for sharing information about SUD resources in Oakland County. That was very informative, and I appreciate that. Next, we'll provide information from a lived experience perspective. I'd like to welcome our Detroit Wayne Integrated Health Network representative, Daryl Barnes-Bay. Daryl is a peer recovery coach from Sobriety House, and he is here to share his story. Welcome, Daryl.
Good evening, everyone. It's truly an honor to be here with you all. I was listening to everything that everybody said, and it was very emotional. Coming from addiction to a recovery coach. I started off early in life drinking and partying and having fun. I come from a long line of alcoholics. Never had an opportunity to really have a chance. Just growing up with the environment around me, soaking everything up like a sponge. It eventually led me to my fourth attempt at recovery, and I went to Sobriety House. I had 3 earlier attempts at Elmer's home. I went to Sobriety House as a suggestion from a friend of mine who had also been a client at Sobriety House before. He told me Sobriety House would help get my life together. So I went to Sobriety House, and I went through a 90-day program. And while I was there in that 90-day program, one of the counselors, my counselor in particular, had triggered a thought in me about going back to school, getting an education. So I went back to school, became an intern at Sobriety House. The therapist that I was working under as an intern suggested that I go to CCAR training to be a recovery coach. I went through the CCAR training to be a recovery coach, completed the class, continued my internship, as well as going to Wayne County Community College, pursuing a mental health degree, simultaneously with addiction studies certificate degree. Sobriety House realized that it would be advantageous to have recovery coaches in residential treatment, and I was partnered with my mentor, Mr. Michael Johnson, and we started the program at Sobriety House. That was in 2017. I've been working at Sobriety House diligently ever since. I became the supervisor of the Recovery Coach Department in 2019. I graduated from Wayne County Community College with my addiction certification in 2018. Since I became the supervisor at Sobriety House, we have embarked upon a great journey. We have the OHH program we have just started last year in June. It's the Opiate Home Health Program, where we are able to continue to outreach the clients that we provide residential service with who have opiate dependents. We can go anywhere they go. Anywhere they go, we can meet them there. If they go to another treatment facility, we can go there. If they get incarcerated, we can follow them there. And immediately, once that program opened up to us, we had 35 enrollees in that program. We also, what I take pride in, we also provide what I call in-treatment engagement as peer recovery coaches with clients. And that has a huge impact because a lot of the clients that come there, they know me from the neighborhood. Some of them know me for being in treatment facilities with me or jail cells with me, and they are able to actually see that recovery does work. We have multiple groups with different focuses because in the beginning when we started this at Sobriety House, me and my mentor, we decided as coaches we needed to have a playbook. So we put together a playbook for our clients that has over 25, maybe 50 topics, dealing with relapse prevention, identifying relapse triggers and cues, understanding family history. Has a variety of assignments in there, along with written assignments to go along with the reading assignments. We also recently been accepted into the DMC hospitals. Our peer recovery coaches have been warmly welcomed in the hospitals using expert to assess health risks for people with an emergency department who come in overdosed or withdrawn from drugs or alcohol. It's been great as a recovery coach. I mean, I was listening to Andrew give his presentation, and they always tell us that a recovery coach ain't this and a recovery coach ain't that, but we do all of that. We do talk therapy. We do advocacy for our clients. We link them to different resources. And I realized Sobriety House had a deficit getting clients during this pandemic, identification that they need to get employment and housing and things of that nature. So we reached out to the Secretary of State, and the Secretary of State comes to Sobriety House. They came twice so far and are returning in May to provide the services that the clients need to get them their identification and things of that nature. So we got a lot of things going on at Sobriety House with our OHH program. We just recently got what they call the Alcohol Use Disorder Program, which kind of mimics the OHH program, where we can follow our people who have alcohol dependence. We can follow them anywhere to make sure to provide services for them, to make sure that they get to their doctor's appointments, to pick up their prescriptions. And we have established a relationship with Goodwill Industries, and they provide employment services, employment for them, and other services. So we're doing a lot of great things at Sobriety House. And like I say, as a recovery coach, it's a great honor to be able to give back to the community that helped make me who I am today. So again, I say it's an honor to be here, and I thank you for letting me share that brief story of my recovery. But it's longer than that, y'all. I'm telling you, it's much longer than that. Thank you.
Thank you so much, Daryl. We really appreciate you being here tonight and sharing your story with all of us. So next, we are going to have some questions that we'd like to propose to our panel of experts to gain a better understanding of substance use disorders. And so for our first question, I'm going to direct that question to Andrew. For those who may be joining us who are new to some of the language that we're talking about and may not understand or may not know, what is addiction? What would you say? What is your definition of what is addiction?
So addiction is, the term, if you look it up in the dictionary, it says someone that's addicted to a particular substance or, habit. We like to think of addiction, I like to think of it personally as addiction as, anything that can lead me to neglect anything else, anything important in my life. And I don't mean to personally define it, but I think, that's something I encourage people I work with to do. What's your personal definition of where substance use disorder can take you? So like I said, I that's kind of how I define it. Like I said, if you look it up in the dictionary, it's just a simple, being addicted to a particular substance.
Thank you so much. I appreciate you sharing your personal definition. All right, our next question that we're going to ask is to Christy. What is addiction science and why, why is addiction science important?
Addiction science is important because addiction or substance use disorders, it is a medical condition, and lots of research has shown that there are actual brain chemistry changes that occur, and defining it scientifically as a brain condition or as changes in brain chemistry that occur can help us to move away from a lot of the stigma that's associated with alcohol and drug conditions. Through the years, through the decades, and these gentlemen, I'm sure, could speak to this better than I, often for individuals who are alcoholics or addicts, there's blame that's associated with that. Somehow it's your fault. What's wrong with you that you can't just stop? And it's that kind of stigma that when we point out and emphasize the science behind what has been determined that and you can see brain scans of how an individual's brain chemistry, the brain doesn't function the same way once alcohol or a drug is introduced. So to say to a person, just stop, we can see from the neurotransmitter changes and the actual changes in brain regions that it's not that simple. It's like telling a diabetic, just control your insulin. It's a very similar kind of process, and we need to emphasize the science and remind people that these conditions are very similar to physical conditions in that same way.
Thank you. Thank you for sharing that information. I do want to make sure that I let everyone know that we are also opening this up for questions and answers. So if you do have a question for our panelists, to please put your question in the chat so that we can make sure that we ask our panelists and utilize their expertise in this matter. So thank you so much. Our next question is directed at Daryl. What advice may you give to someone who may be discouraged by relapse?
And I'm glad you asked me that question because I do this often, and I was talking about this earlier with one of my peers. They teach that relapse sometimes is necessary in recovery. And we were saying that sometimes they give people an excuse to continue to use. But I think the importance of relapse that I tell people is that you learn something different than you did the last time. Pay attention to what was going on inside of you when you relapse, because most people don't wake up in the morning saying, this is the day I'm going to relapse. Something took place inside of you that you didn't know how to handle. You're here with me to learn how to deal with whatever feeling that you had inside that caused you to pick up, knowing the consequences behind it. And I usually kind of cheer a person up and give them, hope.
Awesome. Yeah. Thank you so much for that answer. I appreciate that. Our next question is, and this is open for anyone on the panel to answer. Why is teaching positive mental health and resilience important, and how has the pandemic increased this need?
I think the importance is, and it's been touched on earlier, about the positive mental health. Self-care is very important, and a lot of times people lose sight of themselves when they out in the streets. Even at us working, we lose sight of ourselves. We get so engulfed in what we are doing, trying to help people. People in addiction lose sight of themselves. So it's very important to teach self-care. Also, resilience is one of the things I learned in school. Is one of the most important things in recovery, in the process of recovery. Resilience and hope is one of the two most valuable things that a person need to learn. Because, I always point this out to our guys that come around. I said, most people couldn't walk a mile in your shoes. You are very resilient. You can bounce back from anything. So don't beat yourself up too bad about this. So I think it's very important to pound that in. And what happened during this pandemic, I think a lot of people got a little lazy and they started neglecting self-care. And a lot of people in this pandemic, we didn't know what was going on. They started kind of like losing it. And we neglected self-care, and we forgot that we are resilient, not only as individuals, but as human beings.
But just to add to that, I think that what the pandemic did was also isolate people. And the supports that they had in the past got interrupted by having to stay home and not be able to be around people from whom they had gotten a lot of support. And that really, really made it difficult.
Thank you so much. And I think that is important, that resilience, to highlight that, and that we are resilient, and to also draw on our supports that we do have, and kind of getting creative and making new supports too during the pandemic. So that is awesome. Thank you. Our next question. What are some of the efforts that you all are doing to support the work that we are doing? So in prevention and in recovery and treatment, what are some of the work? And I know you talked about it, but what are some other things that you would like to add to that you may have missed earlier?
So I can speak to that a little bit. Yeah, we, like I talked a little bit about the continuum of care, obviously with outpatient therapists and peer recovery coaches. But I think in prevention, sometimes that's a demographic we might miss, connecting those two. So I know what we've done, a few initiatives. We have some younger peer recovery coaches. We actually, one of our coaches, Annie, became the first youth peer recovery coach in the state of Michigan recently. She was the first certified, and that's a credential for coaches 26 and under. So she's done a lot to really embrace that younger crowd, and she volunteers a lot of her time at, and I didn't talk about the prevention piece, but we do summer camps for anyone, children that are around any kind of substance use disorder. It might be their family, it might be a grandparent, but we do that from preschool to 8th grade, and we do a lot of education around that. So I know Annie in particular just is passionate about the younger crowd, and she does a ton of advocacy with the younger groups. And we just try to be a voice, because I think kids will listen, from a prevention standpoint, to someone that's been through it. They respect that, I think, and not to say that like the education component isn't just as valuable. I think there's just a difference when you're hearing someone that's actually went through something, kind of like Daryl was talking about.
Thank you so much for sharing that additional piece. Prevention is definitely important, and I will definitely keep talking about that and dragging that, as it is dear to my heart, and something that I will always continue to advocate for. So our next question, from your perspective, why is celebrating and bringing awareness to National Drug and Alcohol Facts Week important? So why do we do this?
I think it's important to let people in the community know that it is a set of disorders that affect at least 10% of the population overall. Individuals, anything we can do to sort of, quote, normalize it. Like I was saying earlier about stigma, the more we can let people know, the more it's demystified, the less there's blame associated with it, the more it's recognized that this can happen to anybody. Alcohol and drug use issues don't discriminate. They can impact anyone at any level. And the more we can talk about that, and getting to your prevention point, Rachel, the more we can get to children, whether that's through, like Andrew said, individuals who have lived experience themselves, or as you know, parents. There's a lot of research that shows that parents have some of the most impact on their kids. So if we can help by giving parents information so that they can start to talk to kids at a young age, because a lot of kids are first exposed to, hey, do you want to try this, when they're very young, when they might be 5 to 8 years old. I think it's by the age of 12, 10% of kids have tried alcohol. And I think by 15, it's 50%. So the sooner parents can start talking about it and continue that conversation, make it comfortable for kids. Don't get excited about it, but just provide factual information. The more we can build that resiliency that you were talking about in the earlier question in the younger population.
Thank you.
If
Go
I
ahead.
can add,
Yep.
I just wanted to add, listening to Christy, I was just thinking about early prevention. Early prevention, because I remember when I was growing up, I never seen nothing like this before. Never heard anything like this before. And most of the people who started experiencing with different drugs, they didn't know the ramifications that drug use was going to have on them. But now the youth have the opportunity to hear us. Panels like this, to hear us, and they make them think twice before they go out and experiment with something. So that's what I think the importance is.
Absolutely. Absolutely. As we're coming down to closing, I do want to open it up for the panelists to see if you have any closing remarks before I close out our event for the evening.
I just want to say thanks for letting me be a part of it with the great speakers, Daryl and Christy. Thank you so much. It's always an honor to be a part of this, and I know Daryl can definitely relate. And I know Daryl's mentor, Michael Johnson. I've got the training with him before, and he's just an awesome dude. So, just any way we can be a part of this conversation and reach more people, I'm always all about that. And prevention people, I respect you so much. I have kids now myself. I have a 3-year-old and a 7-month-old. As you've seen in the video, he's a little bigger now. But I just want to bring them up in the best world possible. And like Daryl said, this pandemic has amplified a lot of use. It's isolated a lot of people. So I just want to be, I appreciate you doing this so we can be present to help people moving forward. And thank you so much for having me be part of this.
Thank you. Daryl or Christy?
Yeah. I want to say, share my sentiments. I want to thank you for picking me to be on here. Everybody kept asking me all week, are you prepared? Are you ready? I was like, I was born ready. I couldn't wait to talk about recovery. I just love recovery. The life of recovery, when I talk to my people, is just amazing. Amazing. So I'm just very glad and honored to be able to just share my words. And thank you all.
Thank you.
Well, I wanted to thank these gentlemen because I have the utmost respect for the two of you and your willingness to share what you've been through and the lessons that people, from children to anyone across our 3 counties, can learn. It's so incredibly important. I mean, I've been in this field for decades, but it's really only been maybe the last, I don't know, dozen years or so that we really put this emphasis on individuals like yourselves with lived experience. And as you both know and have so well described, it's incredibly important for people to hear that recovery is possible, and who better to talk about that than ambassadors like you. So thank you both so much for being part of this. I feel like I totally take a back seat to guys like you.
Thank you so much, Christy. Go
Thank
ahead,
you.
Cheryl.
Thank you so much.
Thank you all so much. I really appreciate your time and sharing your stories with each and every one of us. And we don't count that lightly for, taking time out your busy schedule to be here. So we really appreciate that. I do want to make note of something that was shared in the chat. We are also supporting our Farmington High School DECA group, who have been awesome in spearheading this project that they're doing to get all of the high schools in Oakland County to support. And so it's We Wear Purple, and it's a Spring Forward, a project that they're working on to get other students to not use substances. And so on Friday, March 25th, this Friday, we are wearing purple in support of them and their project that they're doing. So if you want more information, please check out the link that was shared in the chat, and also the QR code that is there as well. So with that, I want to thank everyone for joining, and this concludes our presentation for the evening. So thank you all.
Thank you. Have a great night, everybody.
Good night, everyone.